Microneedling. It's a painful procedure to do. It's unpleasant to look at. So guys, if you have weak stomach, please don't watch this video. But if you're interested in this kind of procedures, please stay with me. Hello ladies, welcome to my channel. My name is Oksana. Thank you very much for clicking on this video. Today I'm going to discuss with you microneedling procedures. This is not common video on my channel because mostly I discuss luxury items, shoes, bags, accessory, outwear, but I mentioned microneedling in my monthly favorite, and seems some of you guys want to know more, and I decided to create video. So right now I'm sitting in front of you. It's 4 days after I did the microneedling. Literally in few seconds, I actually, if you're interested to watch the video, like actual procedure of the microneedling, I'm gonna put timing so you can skip right away to that timing. But I strongly advise, after you even watched the actual process of the microneedling, please reverse back, because I really wanna enforce information before you do any kind of procedure such as microneedling at home, the steps that you wanna do. Disclaimer, I don't have a medical degrees. I do these procedures just for myself because I'm hoping to improve my skin. A little bit of history. I used to have a very bad case of acne in my teenager years and in my early 20s, even 30s, etc. And just even recently I stopped getting those kind of like really ugly acne, like cyst-like acne, but I'm still getting acne even at my age. So I have lots of scarring left over from my acne. The procedures that I'm doing right now, microneedling, I'm doing is about over 6 months, almost a year, and I start getting slight improvement of my skin. One thing I want to tell you right away, guys, if you see some kind of advertisement and somebody is telling you, oh, you're gonna have a clear skin in 1 week, I'm sorry to tell you, but this is a lie. You cannot clear your acne scarring in 1 week. It takes time and time and time. So time and patience should be on your side. So before you do any microneedling procedure, first things you have to do, make sure that all your surfaces are clean. So, and I'm obviously inserting the short clip when I'm cleaning all the surfaces in my bathroom. And even if it looks quite clean, you still have to do it because the surface has to be almost sterile. So make sure that everything is clean. After I did the cleaning of the bathroom, and I usually do this procedure in my bathroom, I prepare area where I actually gonna do the procedure. I put clean napkins, display all the equipments, etc. And after that, I actually prefer to take shower. And the reason for that, because it's not advisable to wet wounded area in your skin at least 8 hours after the procedure. So I do a good shower. I scrub my face, I scrub my skin, I scrub my hands, and then I'm ready for my procedure. So after such a long preparation for actual procedure, but I want to make sure that the procedure is quite safe in the home environment. So I took a shower. I'm absolutely clean. I did a good scrub all over my face, all over my body, my hands obviously. I have absolutely clean face right now, no trace of makeup, no moisturizer, absolutely nothing. So I want to come a little bit closer to the camera so you can see leftover of my scars. And I've been doing this procedure for good 6 months, I will say even close to a year. Obviously I have already some improvement, but I still have plenty of scars and obviously the wrinkles due to the aging issue. As I mentioned already, most likely in my introduction, I turned 50 last year, and I'm trying to take care of my skin to the best of my knowledge and potential. So you can see I have almost ice peak scarring on this side. I'm still working on this indentation. I have quite big scar right on my chin over there. I had a huge cyst-like inflammation over here, and it's left huge scarring. I have lots of scars on the apple of my cheek. So I guess this is quite close up. So I would say extremely brave of me. So anyway, I'm ready to start with my procedure. So what I'm doing usually, and once again, you don't have to do this, it depends how aggressive you want to go. I put little bit of numbing cream, and it could be anything. At the moment I have Zensa. I think there is any numbing cream that you can find in the pharmacy. I have just a little bit left over of this numbing cream, and that's what I'm gonna do right now. So I'm placing cream all over my, and it's very thin layer, so I don't want completely eliminate any sensation in my skin, because once again, I want to feel, if I'm going quite aggressive, that I want to still feel sensation, so I'm not going to be hurting myself or damaging my skin more than necessary. So I'm going to leave numbing cream on my face for about 20 minutes, and I'm going to tell you a little bit about the procedure, show you the needles that I'm usually working on my face. Today I have several different style of needles in my possession. Today I'm going to be using 36 needles, so it's the biggest area coverage, because since I'm gonna go all over my face, and as you can see, the needle is completely sanitized. So obviously before I'm gonna start doing the procedure, I'm gonna break the packaging and I'm gonna insert the needle. So the machine is right there. So before I'm gonna start using machine, I have antibacterial wash, anything, any sanitizing antibacterial wash that you have in your possession at home. So I take cotton swab, and once again, just to make sure that everything is clean, because obviously I'm gonna be touching this machine with my fingers, just to make sure that there is no any kind of possible bacteria on this machine. I'm just cleaning everything all the way to actual electrical supply head. The second style of needles, actually I have one more, I guess. So the second style of needles that I have right now in my possession, they call it nano. They're extremely tiny, and these kind of needles are usually using around my eyes area, so because this area is quite sensitive, so that's, or sometime around my lips, because once again that area is quite sensitive. So that's the second style of needles that I'm going to be using today. Few points that I want to bring to your attention. If you decided to do this procedure at home, first and most, obviously you have to consult with your physician or dermatologist. Don't try to do this procedure at home unless if you absolutely positive that it's safe for you to use this needling device at home. I would say right away it's not safe for you to use if you have constant inflammation in your skin. I used to have really bad case of acne, but right now they're not inflamed all the time. I still get some small breakups, you can see time to time on my face, but they're not constantly inflamed. So if let's say you have fairly clean skin of inflammation, but you have, let's say, one large acne or cyst somewhere, just try to go around that area. If you have rosacea or any broken capillaries on your face, once again, consult your physician before you proceed with this procedure at home, because once again, it could be not safe, and you can actually even make the case of rosacea even worse. If you have any break breakout of the herpes, or in the common known name as a cold sores around your lips or perioral area, once again, don't use this machine. Otherwise you're gonna spread all the inflammation or kind of bacteria actually all around your skin and your face, and it's once again the case could be even more difficult. So just before you proceed with any clearing of the scarring, make sure that at the current time your face is not in any kind of inflammation state. Furthermore, you have to know that it's gonna take roughly about 2-3 days for the face to kind of get to the normal looking. It doesn't mean that it's gonna look perfect after 2 days, but on the first 24 hours, most likely you're gonna get some area on your face when your face is gonna get swollen, especially around the eyes area, because the skin is more delicate. You may get kind of like almost like a puffy, inflamed skin. Don't get alarmed unless you feel an extreme pain. So in this case, definitely you have to go to doctor or see somebody in the medical field to assist you. In 2-3 days, you're gonna see slight peeling. Sometimes I don't even have like visible peeling, because I usually try to put some kind of moisturizer on my face. It's a great idea also to mix any moisturizing cream with the 2-3 drops of tea tree oil, because you know tea tree oil is natural antiseptic. So once again, applying on your face, it would be really nice. The second thing, because when you get those tiny wounds to your skin, because they're microscopic but they're still wounds, ideally you shouldn't wet your skin for at least 4, 6, sometimes even 8 hours, especially around the eyes area, because it's a very sensitive area. So my face is fairly numb right now, so I'm gonna wash my hands once again. Make sure that you wash your hands with the soap, get with a good scrub, especially around the nails, so my hands are completely clean. Before I start using the procedure, I'm gonna clean up any trace of numbing cream off my face, once again with the antiseptic wash. Now I'm taking my sterilized package and I'm opening up. I'm not touching the needle head. Just gonna try to, so this is the needle head and it's closed up. So I'm not touching even with my clean hand, so just like that. So now I'm inserting this head to the machine. So here's the adjustments, and I usually start from the lowest point. So I'm gonna start from my cheek, because the cheeks are less sensitive, and right now I put on 0.75. I hope the camera can pick it up, and if I can see, I believe it's 0.75. yes, I put on 0.75 and I'm gonna start with my cheeks. So this is the button that you turn the machine on, kind of hold for several seconds, and you can see the head start moving. So I guess now I'm ready for my procedure. I just increased a little bit of the size needling to 1.5, because on my cheeks I have quite thick skin, so I can go in that size. But right away you can see when I touch my chin, I have a little bit of tiny bleeding. Area where I have more visible scarring, I try to go a little bit more aggressive. my general movement is on the line of the muscles, so I'm trying to kind of pull my skin up toward the line of the muscles. So this is the first few minutes of the procedure, and you can see I start getting slightly red. Once again, you can see this area where I have scarring from that huge cyst. I'm trying to go a little bit more aggressive on the scar. So you can see I have also some wrinkles lined up on my forehead. So you can see I have some wrinkles lined up on my forehead. So I'm just trying to kind of going all over those wrinkles. Beauty, beauty, beauty. So if any of you wondering what kind of pain level, from 1 to 10, right now I'm about 6. Because that's what I said, I put a little bit of numbing cream, but I didn't go aggressive with the numbing cream. I just put very thin layer, and I just left literally for about 10-15 minutes. So because I want to still feel some kind of pains, that I don't overdo it, you know, especially in the home setting, you have to be very, very careful. So I have a sensation, it's not that I'm completely numb. So I'm pretty much halfway through right now. You can see the face is getting extremely red. So I didn't do around my eyes area, and I didn't do my neck yet, because for that one I'm gonna be using Nana needles, which is way smaller. So I'm just gonna finish my face. So now I'm gonna do Nana needles. And I'm gonna do Nana needles for my around the eyes area and sensitive area of the neck, and obviously some of the nose, because the nose is also quite sensitive. So that's how my face looks like right after the procedure. So what I do right now after my procedure, once again I will try to clean up my face with the antiseptic wash to prevent any potential inflammation. So you can see I have some blood on my face. It's already start drying up a little bit. So what I'm doing, I'm not kind of rubbing but more of the dabbing. Some of the blood off my face and just to make sure that it's all disinfected. And believe me, it looks way worse than it actually feels. I know that it looks very, very aggressive, but I'm gonna try to film my face, let's say literally in a couple of hours, and you will see how it's gonna look like in a couple of hours. So right now, face can actually accept any kind of serum or maybe even some kind of treatments that you want to apply to your face, because pores are completely open and you have all those broken little capillaries that goes to the dermis level. So I have several options that I apply. So first and most, I apply my Algenist lip serum. So I apply all over my lips. For my face, I have several options. I have New Spa Total Restore Serum. I have Algenist Retinol Serum. I have Algenist Retinol Serum that I can apply. And my third option, that's what I have right now. Obviously, you can put anything you want. I have Algenist Vitamin C Serum. Algenist Vitamin C Serum. And I guess today I'm gonna apply Algenist Vitamin C Serum because I wanna take care of my, now it's kind of little bit of sensitive skin. Obviously I have slight burning happening. But I'm trying to work on some pigmentations that I have on my skin, and hopefully it will improve my pigmentation. So obviously with this treatment you can go over the décolletage area, but I'm not gonna film that on camera. But that's approximately the procedure. I'm gonna get back to you in a couple of hours to show you how my skin looks like in a couple of hours, and obviously in a few days how my skin gonna look like in a few days, and hopefully with the full makeup looking a bit better than today. Okay guys, thank you. Hello again. It's been about 2 hours since I did the procedure. I'm gonna come a little bit closer to the camera and show you how my face looked like in a couple of hours. So you can see that the redness is almost gone. Obviously it's still little bit of distressed look on my face, especially around jawline and my neck. You can see there is little bit of damage to the skin, obviously over the neck, but over the night it's gonna get much better, and in a couple of days it's barely going to be noticeable. So I'm gonna get back to you guys with the progress on my skin. Okay, bye bye. Hello guys, it's already 4 days since I did my microneedling procedure. So right now you see my face with slight makeup, very light makeup, not heavy. I'm gonna come a little bit closer to the camera so that you can see condition of the skin. I almost didn't apply any foundation, just a slight touch up in the areas that I need to cover the most, if there is any slight imperfection like a pigmentation or some little discoloration on the skin. Otherwise the skin almost bare. So I want to come a little bit closer to the camera and you can look at my skin. I hope that the camera shows. Obviously I have some makeup like rouge, etc. on my cheeks, but otherwise this is the skin. I guess if I'm gonna come fairly close enough, you still can see a little bit of scarring, and obviously it cannot go away with a couple of procedures. It takes time to get major improvements. So I hope guys that you enjoy this video. If you like this video, please leave your comments below. If you want to see this type of videos on my channel, please let me know, because I truly enjoy these kind of procedures at home, that I can personally control the strength of the procedures that I'm applying to my face. I do, as I already showed you, microneedling at home. Before I used to do derma rollers, but I stopped doing derma rollers after I purchased the microneedling device. I do microdermabrasion at home occasionally. I do RF lifting, I do ultrasound, I do red light therapy at home. So lots of procedures, but they're all not invasive, very delicate, and I hope that I get somewhat result on my face, that my face somewhat looking okay. Once again guys, if you want to see more of these kind of procedures or more kind of videos on my channel, please let me know. Don't forget to give me a thumbs up. If you enjoyed the video, please consider subscribing, and I hope to see you again. Bye bye.